So you may.
Yes. So, good evening to all. My name is Rutuja Konapure. I am currently pursuing BA Honors from MIT Pune.
Good evening to all. Myself Palak Sharma. I am pursuing my BA from Maharani College. Today we would be discussing about the topic, a study on menstrual hygiene scheme in rural schools and status of ground level actions and awareness. Education is the key to breaking the taboo around menstruation and promoting menstrual hygiene practices. Menstrual hygiene is a critical issue that affects women's health and well-being. Unfortunately, it is still a taboo topic in many parts of India. It is generally considered impure in Indian society. The cultural and the social influence are always hindered in fostering the knowledge and awareness of menstruation, which has reinforced a negative impact of this phenomena. This affects the mental health and the social growth of women. Data says that half of the girls in rural India do not use hygienic methods during their periods. Studies have revealed over 23 million girls from rural places drop out of school. Even during COVID-19 pandemic, problems faced by women due to the unavailability of resources and improper management of health services make it more important topic to acknowledge and understand. It is an extensive study which make it more challenging to collect accurate data. Hence, the research problem we identify are lack of awareness, lack of materials, lack of facilities, and dropout rates. The significance of our study is to create a healthy environment and life regarding the menstruation and ensure the quality of education and understanding, and provide them with sustainable resources and consumption or the proper usage method. To adopt such method which create a friendly attitude towards menstruation. Objectives. The study emphasizes the knowledge and the exercise of the menstruation scheme and analyzes the influence and the scalability of the scheme. To find out the loopholes in the implementation and justify the quality of behavioral change in rural areas and school, and to ensure the effectiveness of attempts made by government in order to meet the availability of resources to remote areas and rural schools. Literature review. The earlier research paper focused on the level of awareness, ignorance, and limited access to facilities. As our study focused on the meeting the gap limitation and analyzing the broader aspect which ensured the proper facilitation of menstrual hygiene, the impact of it on behavior, and the promotion of open communication in ensuring healthy and safe environment for the menstruating women. According to UNICEF, there are about 71% of adolescent girls in India who remain unaware about menstruation until they experience their first period. The research tries to find out the effectiveness of National Menstrual Hygiene Scheme launched by government in 2011 and which further revised in 2019 and 2021. And the statistics shows that only 73% of rural women aged 14 to 15 years use menstrual hygiene methods for their protection. To widen its scale, different area, they also took initiative to improve sanitation in rural areas. They also collaborated with WASH programs and Swachh Bharat Mission, along with the Ministry of Women and Child Development, to commence the Sabla program to improvise sanitation and water facilities in school and childcare. To better understand this, we studied the two states, Maharashtra and Rajasthan, for the effectiveness of scheme launched by them in the promotion of menstrual hygiene practices. The Maharashtra government launched the Astima Yojana in 2017 to supply sanitary pads, and in 2019, UNICEF partnered with Maharashtra government to promote menstrual hygiene management in the state. The Rajasthan government also launched a similar scheme, Udan Yojana, for the free sanitary pad distribution, and they also linked with Beti Bachao, Beti Padhao Yojana to create a gender-friendly environment among schools and initiate a one-step center scheme for the help of women in rural areas to provide them with the medical help. These programs facilitate the resources and make them accessible for every woman and girl. The study focus on the facilities and improvise the status of national level and creating a gender-free environment for open communication and attaining the goal of sustainable menstrual management, along with the collaboration of civil society and stakeholders to make it accessible for every woman and conquer its challenge and create a free space for them.
Yes. So methodology. So to analyze the ground level reality of various government schemes with regard to menstrual hygiene, a community-based comparative study was conducted between two states, that is Maharashtra and Rajasthan. The data collection were the method of data collection were both quantitative and qualitative. For the same, the fixed set of questionnaire and on-field personal interview was conducted in 3 different rural schools of Maharashtra and Rajasthan. So our total sample, the total sample size of a study is 220, where 110 is a sample size of each state, that is Maharashtra and Rajasthan. These are some of the photographs of on-field primary data collection. The left one is of the Maharashtra state, which is done by me, and the right side is of Rajasthan state, done by Palak. Then findings. So these are some of the questions which are core of our study and the findings. The question that we asked was about awareness program conducted, which is 74.5% in Maharashtra and 72.7% in Rajasthan, according to the respondent. When asked why nearly 22 to 25% did not agree to this conduction of program, the school authority suggested that due to this COVID-19 pandemic from the past 2 to 3 years, there has been break in conducting such programs. Then again, talking about the pad distribution and pad availabilities in the schools, 98% in respondent in Maharashtra and 90% respondent in Rajasthan were positive about it. Then next, talking about the dropout rates, none of the respondent in Maharashtra agreed to the fact that girls drop out of school due to menstruation, while this number is 16% in Rajasthan. The reason for this is basically the stigma associated with the menstrual hygiene and the traditional belief. Then next is the 67% of the respondent in Maharashtra and 68 in Rajasthan stated that there has been an attempt made by schools, school authorities and staff for the open communication. When we talk about the disease awareness, only 5% of the respondents in the state of Maharashtra were aware about the infection caused due to the poor menstrual hygiene, while this number is 9.5% in Rajasthan. When we talk about various facilities like clean and separate toilets, Maharashtra has a good percentage of it, while we see a very low percentage of it in Rajasthan, which is 14.2. Now, based on our study and based on our findings, these are some of the policy suggestions and the solutions that we provide. The first is the creation of the friendly environment to promote menstrual hygiene management. So for lowering the absenteeism, dropout rate, and uncomfort on talking about menstruation among these adults and girls, a supportive, friendly environment can be created by the school can help in promoting this menstrual hygiene management. Also, in the case of Rajasthan, there must be provision of the facilities like clean and separate toilet is essential, because that is like the basic facilities that needs to be provided to the school. Disposal of the sanitary waste. So plastic use in the sanitary napkin is basically non-biodegradable, which is risky to the human health as well as environment when it is not disposed properly. So awareness on the disposable mechanism and strategic sanitary waste collection need to be made. Then the next is promoting sustainable menstrual products. So along with distribution of the sanitary pads, promotion of the sustainable menstrual products like menstrual cups can be a solution for pocket-friendly as well as environment-friendly menstrual products. Then the next is providing medical support. So according to our findings in Maharashtra, like 78% of the respondents stated that the school do not have medical consultants, whereas the girls experience menstrual disorders that needs medical treatment. So government can invest in providing such medical support by setting healthcare camps in the schools once in a while to check up the menstrual health of the girls. And the next is collaboration. For effective implementation of the menstrual hygiene, it requires collaboration. Like school can collaborate with gram panchayat, with various stakeholders like civil society and the communities in the rural areas, as building partnership can promote innovation and a sustainable solution to this menstrual hygiene challenges. And then, by concluding our presentation, I would like to say that providing girls with menstrual hygiene should be one of the top priority to the school, because we have arrived at the point where we must end the silence and stigma and taboo surrounding this normal occurring phenomenon of menstruation. It is essential that we teach not only girls but also boys about the importance of menstruation and the hygiene associated with it, also for open communication and comfort. Thank you.